And so the next item we have is substantive, and it is the quarterly report that we receive from each department. We hear from each department at each meeting, and so we hear from each department 4 times a year. And this month, December 2020, it's the police department's opportunity to update us on some usual data points that they tell us about vacancies and response times and things of that nature, and then also a extra bit of questions that we had about COVID.
Well, how are you doing, commissioners? I hope everyone had a great holiday. This particular quarterly report, we were going to start off with something new, which is our crimes against persons, property, and society, as we have moved from a UCR reporting structure to a NIMBS reporting structure. By the chance, is Dr. Cringen in the waiting room?
I see him on the participant list.
Okay, there he is right there. All right, what I wanted to do was actually, Dr. Cringen has been very instrumental in our, with our Chief Data Officer, with working with our transition to NIMBS, and wanted him to start off by going over our statistics specifically about crime and sort of explain to you guys the difference in how we're reporting and where you can locate that information. Go ahead, Dr. Cringen.
All right, so hello. I just wanted to talk a little bit about some of the things that are happening and some of the issues that are coming up with reporting, given that we're in the NIMBS transition period. For anyone who's not familiar with it, historically, Austin Police Department has calculated its understanding of crime using the Uniform Crime Reporting Standard of the FBI. And the FBI has an initiative that's ongoing to transition police departments to using the National Incident-Based Reporting System. And so I'll just give you a very brief overview of the types of things that we see here. When crime happens, we would maybe think about that as a crime incident. And if you think about how you might count it, there are a variety of ways. Under the old UCR rules, that incident was classified according to the highest level offense that occurred during that incident. And everything else below that is lost in the UCR standard, right? So if we might think about something where there would have been maybe a drug-related charge along with a violent charge, the violent charge is more serious, and that is what the incident would be counted as. That underlying drug-related charge would not be counted. Now, the National Incident-Based Reporting System actually counts all different activities during an incident. And so the result is that when you count things, you're coming up with very different counts, even if it's on the same data, right? So when that happens, what we begin to do is be able to, with the NIMBS data, think about the number of unique incidents, the number of unique victims, or the number of unique suspects, and recognizing that any single incident can be a variety of different crimes with a potential different number of suspects and different number of victims. So the complexity is actually substantially greater, and it does relate to issues in comparability. So that's something we need everyone to be aware of. Again, 2018 is the last year that was reported under the UCR standard. 2019 was reported under the NIMBS standard. And currently, FBI has not released national NIMBS numbers. So we have a limited ability to make comparisons to what's going on nationally. We also have a limited ability to make historic comparisons. Having said that, we can manipulate data in some ways to get comparisons, but it's a much more involved process. In doing that, there are a couple of key things that are happening. Recognizing the other issue that happens is that the categorizations are a little bit different under NIMBS. Probably the biggest example is robbery. Under the UCR reporting system, robbery was treated as a violent crime, and the nature of the interpersonal activity of it was used to sort of place it in that context. Under the NIMBS standard, it is a property crime, right? So anytime we look at things that are even generic larger categories like property crimes, the way we might conceptually think about that, there are going to be differences as well based upon that classification. NIBRS actually counts things as crimes against persons rather than violent crimes. That's likely the most closely related to violent crimes. And when you count under NIBRS crimes against persons, you're counting victims, not incidents. They also use a classification of crimes against property, which is the equivalent to property crimes. And when you count property crimes, you're actually counting offenses, not individuals. The final category under NIBRS is crimes against society, and that's also going to account using the offense level counting rather than the victim or suspect level counting. So we have a number of differences that we need to kind of be prepared to understand. So in crime analysis, we can go back and look at these things, trying to render comparisons. And when we do, and we basically recode the data back into the UCR model, the most important issues that we see that are coming up actually do relate to increases in related to violent crime. And so the ones we want to highlight are specifically that our current year-to-date counts for murder are up 50% for the year. And comparing October of 2020 to October of 2019, we actually see a 400% increase for the month of October. We had a weekend where there were a number of murders that occurred on that weekend, and it has very much spiked in the measure. I always want to advise caution when thinking about percentages, when we're thinking about things where the counts tend to be quite low, right? So when we talk about changes of 50% or 400% in an event that we might have thousands of, that's a more meaningful understanding of a percentage than when we're looking at murder, where the actual count is quite low. So, but we do see it in other categories as well. In particular, aggravated assault, which under the NIBRS model, we actually do a little bit more breakdown in. We report it as aggravated assault related to family violence or non-family violence. We want to note that that's up by about 32% for the year. So non-family violence aggravated assault is going up, it appears. And very importantly, what we're seeing is a high prevalence of guns and a high prevalence of gun crimes, right? So we're up about 43% in the third quarter of 2020 for violent crimes involving firearms. And if we take a look at it, we can say that if we go back and we want to count this for comparability's sake under the old UCR rules, if we look at, say, violent offenses involving firearms, we are already past year to date. As of the end of October, we were already past the total number of firearm-related violent offenses for 2019 and all previous years since going back as far as 2020. So we will definitely end the year much higher. Does seem to suggest that there is a reasonable increase in violent crimes related to firearms. And in particular, that is playing out when we break the data down and we break them down into the categories of the violent crimes that fit under UCR of murder, rape, robbery, and aggravated assault. It's primarily happening in the aggravated assault category that the firearm usage is going up, in particular that non-family violence variant of aggravated assault. So that's where we're seeing the single largest increase. So those are the key crime trends that we discussed in our last CompStat meeting, and those are the ones we want to make sure that you're aware of.
Can you move the slide to property crimes now?
Does anyone have questions on the citywide, the first slide? Yeah, okay.
I would just recommend that, as you were saying, when numbers are really small, percentages don't have any meaning. I would almost establish like a rule of thumb, because somebody's going to look at that 400% and think, my God, we've all gone to hell. So I'd rather see that be a blank than a 400% there.
So that's definitely something we want to consider. It is highly advisable to, particularly when things tend to be under about 10.
Right.
When you think about the variance properties of small numbers, if it goes from 1 to 2, it's 100% increase.
Right.
So the other issue that we have, the tendency in most reporting is to break things down by months. Branching effect, right, which the month is relatively arbitrary. Yep. So as we have an event that might occur on the last day of the month that in the previous year might have occurred on the first day of the next month, that will, skew those percentages substantially. So we always want to think about, really can't think of October without thinking about September and November. And we'll have our November data situated in the next week so that we'll have a sense of whether we see that continuing into November or whether we see a drop off there.
Yeah.
So, Dr. Kringen, do you see a trend here in this slide? Or are you drawing any conclusions from what we can see here in this slide?
Yeah, so in our analysis, the one that I want to actually, that's hardest to see, is actually in that aggravated assault category. And that is the category that we want to pay the most attention to. Particularly, it's not disaggregated here, but in that non-family violence area. And we see those increases, that 13% change, the year-to-date 19% change. As we break that down into the family violence and non-family violence, that's primarily happening in the non-family violence area. And again, if we then subset that looking only at the firearm-related ones, that's where we're seeing this very important increase. Trend analysis is always difficult with limited time periods. And given that we are in the pandemic, it makes it much more challenging to ascertain whether things are trending or whether that's short-term volatility. But I would say the initial indication is that in that particular category, aggravated assault, non-family violence with a weapon, it looks to be a trend.
And safe to say that you do not see a trend with regards to murders, and you're not drawing any conclusions with regards to murders.
I would say no. I would say that given the actual number of murders that occur in the city of Austin, that is a number that we would rarely ever see a trend. We'd ever be able to describe as a trend, rather than, if we think about, the number of actual murders, we recognize that if you have, and I pointed out to the fact that we had a bad weekend where we had several murders on that particular weekend, more than what we typically see on a weekend, and that created a very huge shift in the percent, for the month. And so we don't want to call the murder change a trend per se. We don't have any statistical evidence to support that. It is something that we're concerned about given the gravity and whatnot. And we do want to make everyone aware that we have seen that this number is higher than it was last year.
And so are you drawing any conclusions from that? I mean, 26 people is horrible and 40 people is horrible. But are you drawing any conclusions in the difference between 2019 and 2020?
Not at this point.
And so, we see this in the news a lot locally. Every time there's a murder, we hear alarm that we've had more murders this year than last year. Do you think that alarm is warranted?
So I would say, and there is a substantial interplay between the gravity of murder as a crime and the interpretation of murder and the frequency of murder. Generally speaking, and this has been sort of one of the kind of informed policies about it, as a department, it's actually more functional to look at the combination of murder and aggravated assault and robbery, traditionally when robbery is placed in as a violent crime. Given that, particularly if those involve the use of a firearm, because frankly and scientifically, it's understood that the difference between a murder and an aggravated assault with a firearm has a very random process associated with it. If there is a gunshot in that circumstance, whether it is a murder or not becomes a legal classification and something that may have happened based upon time to hospital, the facilities that were there, et cetera. And so it's better to put all of the violent crimes sort of together and think about what that means as a trend, rather than to parse out any individual category like murder. When we do that, again, we are concerned about the increases, particularly being driven by non-family violence, aggravated assault using a firearm. Those are events that could very well be murders had they happened slightly differently. Does that make sense?
It does. And then just, the way that this issue of, crime data points has been laid over the issue of, what our city council funds as far as public safety and what its priorities are. A lot of people want to take the 400% murder uptick, for instance, that you have put here on this slide, and relate that to the city council's decision to reprioritize how it pays for public safety. Are you drawing any conclusions between the city council's change in priorities and these crime statistics?
So I would say scientifically, that's the, whether there's a relationship or not, to me is a scientific question. At this point, we actually don't have enough data to determine whether or not that is not the case. So I would be hesitant to render some kind of conclusion. It would largely just be an opinion. And so I do think that there are concerns related to what happens with particularly police patrol in the city. But I think that making a statement that says that is causal or related to what we're seeing in terms of changes, particularly going back and pointing out that 400%, and it is a terrible series of events, but 400% in murder relates to 4 particular individuals. And so it's very difficult to draw, a conclusion that there is a relationship between those two things. As we have more data, we will be exploring it. Obviously, this is something that's of great concern to us, and we'll be dedicating some resources to understanding how the functional operations change as a result of changes in personnel and budget, as well as how crime patterns change. And over time, we'll have a better understanding.
And you mentioned that you have your own opinion on it. Do you mind sharing that with us?
My sense is, it's non-scientific. My sense is that over time, you will likely see, with less policing, you will likely see more crime. And so,
and you're particularly talking about less hours patrolling?
Particularly, it's been, scientifically, what I can say is that early kind of research into patrol said, look, there's no effect. Patrol doesn't do anything. And a lot of people have maintained that perspective. Kind of later, more scientifically valid research has shown that actually well-organized patrol can be very effective in deterring crime and reducing levels of crime. And so the issues there are primarily resource issues. To run a large-scale, strongly evidence-supported directed patrol program, you need a substantial amount of analysis, you need a substantial information dissemination system, and you need the patrol resources to be able to do that, in addition to what we primarily do as an agency, which is respond to calls for service. So the call for service demands are always challenging in any police organization. And so that'll necessarily create an interplay between what you can do with proactive patrol. So my opinion is that, based upon my understanding of the scientific evidence, over time, if you reduce resources for patrol, if you reduce resources for analysis to support patrol, you will likely see changes in the levels of crime.
Final question. I think this is not a slide that we had requested, and it's not part of our quarterly request to your department. I think it's telling that you decided to put it as the first slide on your presentation. Do you want to talk a little bit more about why you thought this was the most important thing to start with?
Would you like me to answer that, Jonathan? It was my decision to put that on the slide. I felt it was important to be able to let you understand the differences between NIMBS and UCR data. This was more of an informational a slide. As you can tell, that our overall persons and then again our property are down 1%. Sorry, I'm getting some feedback. But it was just more of just to give you an idea of the tool and how to look and read the data between NIMBS and UCR.
I don't see anything about UCR on this. Is that on here and I'm just missing it?
We have historically reported on UCR for the last 20 years or so. So this was an opportunity, since we were transitioning to reporting using NIMBS. This was more of a opportunity and an informational time to be able to share with you the changes.
All right. I think that it could in some ways be misconstrued. And despite Dr. Kringan's and Dr. Kelly's admonition that we be careful about drawing trends, I think I don't know. I would be disappointed if we saw something like this in the future without at least some of that context in it.
Again, was just trying to give you a very robust overview in this quarterly report. But if it's something that you want us to remove and not to report on, then I will remove it for future presentations.
I think it is very appropriate, Chief, to have what we typically have, which is a yearly longer discussion about the crime from the year before, typically in February or March. I do not think that this is very informative, but I would never ask you to not give us information. So I would say, continue to include it. And then I think, we can continue to put the caveat on it. Is this available to us and citizens to go and see the other months and things of that nature, Dr. Kringan?
Yeah, so we make all of our monthly reports available. They're all disseminated via the website. And so citizens have access to these for every month. Generally speaking, we provide our end of month reporting is generally reported about the 15th of the following month. And so those go up at that point. So this information is available to the public.
And will you just tell people what that website is?
I'll have to actually pull the link for you. It's through the data portal. So
someone could go to the APD website and then find the data portal?
Yes, if you just go to the APD website and on the right-hand corner, it says Chief's Monthly Report. So you should be able to gather all the reports from that link.
Okay, thank you. And I'll just reiterate, Chief Gay, I would never ask you to not give us information. I would just ask that information, be given the proper context.
And I think Dr. Kringan has done a very good job at providing you information and putting it into the context that is deserving. Are you ready to go to property crimes?
I had one quick question, if that's okay.
Yes.
There was some distinction made or some parsing of the aggravated assault category as not non-family versus family violence. Is that sort of parsing also available for the murder category?
The murder category, the murder category is not parsed that way. Again, as we move into the NIMBS model, we have additional ways of doing some parsing. Generally speaking, because murder is such a rare event,
Right.
we do a substantial amount of follow up into each murder, so that we have a larger understanding. I think that there are in many jurisdictions, I will say it this way, there are reasonable concerns about, given the low sample size, given the few events that there are, about what you actually report related to murder. In other words, it's much more difficult to maintain anonymity in a murder than it is in any other criminal event. So the only other category that really falls into that regularly in departments across the country would be sort of sexual assault, right? So those two areas we're purposefully considered about what's actually going to be reported there. And internally, we do a substantial dive into what the factors are related to each murder, obviously. The only other thing that comes up in it, which is worth understanding, is that from time to time you will encounter, and this is one of the things that we have to really work on from a communication standpoint, to getting people who are the primary users of the police department's data to understand, is that the murder number actually can go down from time to time. The reason it can go down is that there is also a legal aspect about what the determination is. And so at times we will count murders at a certain number, and then additional information will come in. One of the very common ones is actually the row right below it. is that if it is legally determined that it is not murder, it did involve perhaps a gunshot, it did involve someone, it did involve a death. But if it legally shifts away from being murder, it will actually come out of that category. So we do see times where the number actually goes down. And that's something that everyone looking at murder needs to be aware of.
Okay, thank you.
Okay, do you want to shift the slide to property crimes? Go ahead, Jonathan.
All right. So as we look into crimes against property, again, what we're seeing here is that we're seeing the categories that we see the larger percentages in. Again, you might notice an extortion, for example. Those are categories that have very, very few events commonly. So we're not seeing a lot there, right? Purse snatching, you might notice, is 100% increase. What we're seeing here seems to be more indicative of what we would just categorize as temporal variation, right? We don't see anything here that is jumping out as a substantial increases. It's going to take a little bit more time for us to get the last quarter of the year in, and this will be something that will be generally more informative at the year end. We do, for the purpose of understanding what's happening, for the purpose of patterns that assist with sort of management in the organization, we do a lot of the comparisons like October of 2020 to October 2019. As we stretch those time periods out and look at whole years, it gives us a better picture.
Any questions about property crimes? Can we move to the next slide? This is a new slide that is included in NIMBS, and so this is sort of a new area. I just wanted Jonathan quickly to talk about it.
Yeah, so crimes against society is useful in the NIMBS model. It's very helpful. Generally speaking, these are the sort of social order violations that we would deal with, but they give us. One of the reasons that this is very important in the NIMBS model is that many of these are things that would legally what we might refer to as a lesser included. Oftentimes, these are things that would come up where there's another crime involved that under the UCR counting rules would be a higher level crime. And so a lot of this isn't counted very well in the UCR model, right? Again, the example that I generally use is that if you have an event involving drugs as well as violence, under the UCR model, it's going to report the violence, but not the drugs. And so this category of crimes should be very useful, particularly as we move forward and begin to establish some baseline data. But it is something that that is important in the NIMBS model. It's something that does give us a lot more information about some of the other things, and particularly, and I would say this in the context of the drug-related offenses, and particularly things that might be relevant to situations in which higher order crimes may occur.
Thank you, Jonathan. Any questions regarding the crimes against society? And just for your information, as you can tell, a lot of these particular crimes, there's a lot of them, so you may not know exactly what the definitions are. On our website, when you go to the reports, we actually have the definitions lined out. So if you're curious of what the legal definitions are for those particular crimes, you can find those on our website attached to the report. We'll go ahead and move to citywide response times and calls for service. As you can see, our target is 810 for priority 0 and 1 calls. These are the most urgent calls that either property or life or something that we're trying to respond to quickly. For June, July, and August, you can tell that we were a little bit over our response time goals. Are there any questions for our response times? Ready? If we would go ahead, and I know that the next two slides are just broken out specifically in areas. Were there any areas that anyone had any specific questions on regarding our call volume and response times? Okay, can we go to slide 8? Okay, overtime spent. As you can tell, our overtime budget is about 3.5 million. To date, we are at 53% spent of 1.9 million. Any questions?
Chief Gay, can you hear me?
Yes, I can hear you.
Okay, this is Rebecca Bernhardt. I've been trying to ask a question. Would it be possible to add to this report the rate that property crimes, crimes against people, and crimes against society are being solved?
Yes, we do have that information, and we'll make sure we include it.
Great, thank you very much.
Problem. All right, if no questions on overtime, we'll go to staffing. As you know, our authorized strength is 1809. Currently, we have 1770. This report was gathered, or at least our numbers, about 4 or 5 days ago. I believe we're at 43 now for our current vacancies. For our civilians, we did have 76 vacancies for our civilians. We were given the approval to go ahead and fill some of those positions. We're still carrying about 31 civilian vacancies throughout the department. And then as we are meeting our cost saving measures, we'll be filling those positions throughout the year. We did have a graduating class, the 143rd. They started with 58. They ended with 42 in October, and they will be released on January 17th. And at that point, we will have no cadet classes at that time riding out. Everybody will be on full service. That is the end of this particular presentation. Before we transition to the COVID presentation, is there anything that you would like to see in future quarterly reporting, or any questions on this presentation?
I have a quick question on the graduates from the academy. Any idea why you lost for the attrition there from 58 to 42?
Yeah, I would just follow up on that, Chief. Is 70% about typical for who passes? For the passing rate?
Did you say what percentage did you have? We usually lose between 18 to 20% each year, so this is about average. But it's for various reasons of either they chose to resign, or it was academic or physical fitness reasons to where they were removed from the academy. And occasionally it's through injury, and their injury, they're usually processed into the next academy, which I believe we have one right now that is being reprocessed due to an injury.
Okay, thanks.
No problem.
Nellie, yes.
I actually would really like to see, and I don't know if it's possible to like cross-reference this data this way, but I would love to see the weapons law violations in relation to the violent crimes involving firearms. It would be really nice to see how that data correlates to each other and how many of those crimes are coming from lawful weapon ownership versus non-lawful.
Okay, fair enough. We will see if we can try to incorporate that. Anything else? Dr.
Thanks, Dr. Kringen.
Thank you. And I'd like to introduce Rick Randall. He is our division manager over our employee health and wellness. He has taken the lead on our COVID efforts, and I believe that he will provide you the best presentation regarding our COVID efforts in our department. So, Rick, go ahead.
Thank you, Chief. Good afternoon, everyone. Hope everyone's having a good day and staying safe and healthy. The numbers that I'm going to give you are slightly different from the numbers that you'll see on the slide. And the reason for that is we put these numbers out at 10:30 this morning, and I have a live sheet that updates me consistently through the day. with the latest numbers. So it's not big differences, but you will notice there's a couple of differences. In terms of our positive COVID cases, we've broken out the sworn versus the civilian. We have to date, going back to March, we have a total of 78 positive COVID cases among our sworn personnel and 35 among our civilian personnel. So roughly that represents about 69% of our cases have been on the sworn side, about 30% or so have been on the civilian side, particularly in the communications workers. The positive COVID cases that were covered by workers' comp, so that would be you get people that are COVID positive because they got an exposure at work, and you have people that are COVID positive because they had an exposure outside of work, family, friends, etc. So work-related, we had 57 of our cases on the sworn side were covered by workers' comp. So that's like 73% of our sworn cases, and then 24 or 69% of our civilian cases. So in both cases, the majority of the positives were coming from work-related as opposed to family-related. Now, I'll put this caveat on there. It looks like for about the last 5 weeks or so, we've seen that kind of turn a little bit where we're getting more cases that are caused by family exposure than are caused by work-related exposure. Looking at the employees that we have currently off that are due to COVID-19, we have 40 sworn that are off, 14 civilian, and cumulatively, we had, I'm going to throw my glasses on, before taking ones out that were previously exposed, which is 358 sworn and 119 civilian that previously were positive. That gives us a total of 398 of our sworn personnel have had COVID or tested or were off due to COVID, and 123 of our civilians were off due to COVID. And that would cover not just people that tested positively for COVID, but who were off with childcare issues because of COVID-19 or spousal related. So employees that were given ADA accommodations due to COVID, we had 9 of our sworn personnel and 19 of our civilian personnel that sought ADA accommodation due to COVID. I know one of the questions that you all had were how many people were teleworking because of COVID, and we've made teleworking so available. We haven't kept track of that in relation to COVID exposures. So pretty much anybody that was able to work was able to continue working with either from home or by taking time off. So employees who received city emergency leave, we had 136 on the sworn side, received the emergency city leave, 110 on the civilian side. And employees who received city emergency leave due to an exposure that was related to work would have been 113 of that 136 on the sworn side and 60 of the 110 on the civilian side. And of those who received city emergency leave and extended FMLA for care of their children, we had 114 on the sworn side and 45 on the civilian side. Essentially, the default in our mechanism has been we assume that the exposure is work-related unless we get specific information otherwise. So no one has had to use personal sick leave to cover their COVID illness. It's either been covered by emergency leave, emergency city leave, or emergency city leave plus some extended FMLA. So that's pretty much our numbers if anyone has any questions.
I had a question.
One. Sure.
It was actually just about any attrition. Have you guys had any attrition just straight up, resigns because of COVID?
No, we haven't had none. And we have, however, had cases where people have applied for special consideration as we've had to do our staffing adjustments, and where we have been able up to this moment to accommodate everyone who needed to get a special work assignment due to COVID concerns, like a family member who had COVID, or they had a family member who was high risk, and they wanted to be sure that they could take care of them. So we've been able to, fortunately, up to this moment, to accommodate all of those. Anyone else have a question about that? Okay, my last thing, and it's.
I just wanted to say thank you to the department for not making people, for allowing people to use these emergency leaves and not making them use their accrued leave.
Well, we try, particularly since under Chief Manley's leadership, we created the Health and Wellness Division and brought our mental, physical, and spiritual health components all together. We have made every effort to take care of our people because we do believe they're our most valuable asset. And to that end, to date, we have tested almost 1,100 of our folks for COVID. So we're trying to stay on top of this as best we can.
May I ask about the COVID potential for getting the immunizations? Have you all looked into any of that? Is there any plan on how that might look if we get that offer for our public safety folk?
Yes, and thank you for that question. So the state has designated in the first rollout of vaccinations 1A, 1B. 1A will be those who work in hospitals, nursing homes, patients in nursing homes, mortuary care workers who are doing embalming on folks that are COVID positive. They'll get the first doses. So it depends on how many doses we are delivered as to whether we move into 1B, which is the first responders. And we have tiered our workforce so that we have a level 1, which is everyone who's interacting with the public. Level 2 is employees who are interacting with employees who are interacting with the public. And level 3 is those who are completely teleworking. So we're ready to phase in, to roll out in phases for vaccination to take care of our most at-risk employees just as soon as we get the green light. That is likely to be not until the end of January or end of February, we think.
There's no way for us to try our best to get this personnel moved into 1A categories. I guess we just kind of have to wait, right?
Yes, sir. It's completely dependent upon the state. That's the way the state has allocated it, and pretty much almost every state has done that because that was the recommendation of the CDC for how to roll out the vaccine.
Thank you. Appreciate it.
Yes. Mm-hmm. Any other questions? Okay, well, thank you for your concern for our folks.
Thank you, Chaplain Randall. Always nice to have you. All right, any discussion before we move on to the next agenda item? So a quick time check. We are 8 minutes behind, but I have every confidence that we'll make it up.